Whether it's flying an airliner, coaching a football team, or running a hospital or health system, the skills and experiences of the people at the helm make a big difference in the success of the journey. That's why the recruitment and diversity of composition of the Board of Trustees is vitally important. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. Everyone uses healthcare a little differently, and the board that brings a wider range of viewpoints to its oversight of a hospital or health system is better positioned to meet the variety of patients' needs, as we hear in today's podcast, hosted by Sue Ellen Wagner, Vice President of Trustee Engagement and Strategy with the AHA. Sue Ellen, over to you.
Thank you, Tom. I'm happy to be with Schonay Barnett-Jones, trustee at Children's National Hospital in Washington, D.C. Schonay is also a member of the American Hospital Board and the AHA's Committee on Governance. Schonay, it's great to be with you at the AHA 2024 Leadership Summit.
Thank you for inviting me.
Our topic today is board recruitment. Board recruitment is an important part of good governance. The composition of a board is a major factor in board effectiveness, and diversity is an important strength. When I mention diversity, I'm referring to gender, age, race, experience, disability, etc. According to the AHA's 2022 Governance Trends reports, hospitals and health systems are making some progress on gender diversity, but need to improve on recruiting younger trustees. And when I say younger, I'm referring to people 50 years and younger. Can you comment on the importance of board recruitment and having diversity be part of the recruitment process?
Absolutely. Firstly, I'd like to commend boards who are continuing their diversity journey. This is hard and intentional work, but it makes a difference in the level of effectiveness to support organizational and community needs. Generally speaking, as you know, boards traditionally consisted of an older demographic with the same experiences, and in many cases, same gender, race, and level of financial contribution. Board recruitment is important to ensure an infusion of new ideas, levels of experience, and to maintain sustainability in the marketplace. And having a diverse board provides space for varying perspectives to be heard because everyone uses healthcare differently. What we understand is that Gen Z, Gen X, and millennials view healthcare through a tech lens. They want everything online, they want it quickly and readily available. But their expectations of how healthcare should work for them are very different from their parents' generation. So in order for boards to better support our organizations, we must be reflective of our communities and this younger demographic in particular. We can't get their input unless they're invited to participate. We must keep in mind also that they may not have the financial wherewithal for charitable contributions at the level that most boards are, but they bring talent and they bring commitment, and those are very valuable assets to any board.
I agree with that. Thank you. Hospitals and health systems are often challenged with recruiting new board members for a few reasons. Some of those you just mentioned. One being competing for board members with other organizations in the community. And then second, being a hospital or health system board requires significant dedication of time. Can you respond to these challenges and how hospitals and health systems can overcome these challenges?
Yes. It's important to cultivate your own board talent. Hospitals and health systems have so many community touch points that really just go untapped. We don't look at all of the community assets that we have. I would look to the community-based organizations, professional organizations, and internally for recommendations. Also, to ask your current board members to access to their networks. I joined the Children's National Hospital Board at age 42. I was by far the youngest board member there. However, prior to that, I had been actively engaged in committee work and chairing the Patient and Family Advisory Council, but only because my daughter's nurse invited me to participate.
Wow.
So my experience is lived experience. My daughter Olivia's post-cardiac transplant, and we have spent a significant amount of time in hospital settings. So my contributions to the board table are really lensed through that of a consumer and the voice of patients and families. But to your second point, board work grows legs, and anyone who is on a board understands exactly what I mean. And so your members often end up on multiple committees with varying time needs. So you really have to be honest upfront about the time commitment and the expectations so that candidates can make good decisions regarding their ability to serve. And then you also have to be very creative with scheduling and the use of technology to support your members.
Great points. Time is of the essence.
Absolutely.
Can you share some board recruitment strategies that will be helpful to others?
Yes, yes. Firstly, I think you have to understand your current board landscape so you know where your gaps are and don't end up with a mini law firm on your board. I have a colleague who mentioned that he had 16 attorneys on his board, and I said, you actually have a law firm. That is
Yes.
not a board. And
You're
so
right.
we joke about that, but I think he is in the process of trying to make some changes to that. But in all seriousness, you must diversify your recruitment team and those persons who vote on your board candidates to add balance to the process. The diversity lens should permeate throughout your recruitment process and not to be solely focused on your candidates. Based on your board's needs matrix, recruitment should be from various industries, obviously, community partners, and consumers. But I think that diversifying the recruitment team is key and is a linchpin in the entire process.
Yeah, really good points. Schonay, is there any additional information that you want to provide to our listeners?
You have to be intentional about your diversity efforts. It is hard work. It is not the easiest path to take. And not to give up because it gets hard, but really dig in and know that at the end of that journey, that you will have far-reaching impacts into your organization and your community. And those decisions will transform healthcare for those people in your community. So I think that you have to just really continue to work at it, keep your efforts up, and continue to move forward.
Excellent points. Schonay, thank you for your time during this podcast. AHA appreciates your leadership and the insights you shared.
Thank you so much for having me. Have a great day.
You too.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.